The way I look at telemedicine is really not from a technology standpoint, but from a process and approach standpoint. It's how do we put the person and the patient at the center of care all the time? How do we bring the right care to the person when and where they need it? I certainly would never be an advocate for using telemedicine exclusively. You got to have that time together. But what telemedicine does and what patients like, much more convenient, many more touch points. Patients like this. They don't want it exclusively, but most people say this is a heck of a lot more convenient. Don't have to take a day off from work, or my daughter doesn't take a day off to work to take dad to the doctor. Today, what are our doctors doing? They're seeing a mix of often they're seeing a patient in the clinic, they're seeing a patient virtually. Clinic, virtually. In between, we can clean up the room, have more spacing, create the very safe environment that people are looking for who need to be seen in person. So when the COVID hit, we actually had some foundation laid, but we didn't have much acceptance of it. Obviously, COVID changed the rules. We went from our 20 to 50 visits per month up to over 50,000 visits per month.
So we started the virtual rounding process in the middle of the COVID pandemic, and what we started with was essentially using iPads to allow additional physicians to round with our hospitalist to see patients in real time. So instead of the traditional model where all the subspecialists would come in and see the patient individually, this set up the scenario where we were able to have the hospitalist lead the rounds with the nurse at the bedside as well, seeing the patient with an iPad connected to a second iPad in a room where we had our pulmonologist, cardiologist, infectious disease physicians, as well as pharmacy case management, and our physician advisor involved actively all together seeing the patient.
So I think in terms of the COVID rounding, I think they get to see all the doctors at the same time. A lot of times in healthcare, patients complain about, oh, no one's talking to each other, because I come into the room and if someone else has gone before me and said something different, but they have not put it in the chart, or I haven't had the conversation with them, I go and say something different. And then there are mixed messages, and sometimes that could be frustrating for patients. So this specifically has helped that all the doctors on the case are in that room with the patient, some virtually, me in the room and the nurse and the respiratory therapist. So we're making a decision for the patient, individual decision for that patient with everyone involved.
I think the nurses liked it too because, they're the ones that are there with the patient all day, taking care of them, and having everyone on the same page and having everyone with the plan in place, I think was helpful for them, and I think that they liked that, and I think the patient liked that. So I think everyone being happier with an understanding of what we were doing, I think was good.
It's nice to be able to have all your physicians right there on the screen. You can kind of bounce your ideas off of each of them. They can all provide you with feedback from their own fields.
We have seen a great need for telesitters. When COVID came around, we saw an increased need for that because we weren't having family and visitors at the bedside, so our patients were alone in the room. They didn't have that extra reminder to stay in bed, or we can have the iPad. We have it on an IV pole. It's plugged in the room. We've got it tucked away in the corner, so it's unobstructive to staff and anyone entering the room or needing to work with the patient. The patients are monitored by a PCA who's sitting down, and their sole job is to monitor patients via that Microsoft Teams application. So currently they have up to 4 patients that they can monitor at one point. So they have constant eyes on those 4 patients, so we can be a little more proactive and hopefully get to the bedside sooner.
The healthcare in the US has talked about we need to move forward with leveraging technology and move into the future. And it seems odd to say it this way, but maybe a blessing that kind of came out of this crisis is that it helped us move something that maybe would have taken a decade to get done. We were able to do it in a few months. It really did show us that it's improved communication and it's really helped coordinate care.